Dear guests, partners, experts, and colleagues, we are very glad to start our webinar. During this session, we're going to speak about the story of piloting a nationwide integrated social protection MIS, with a very strong focus on the case of Barbados. My name is Sergey Gasparyan. I am a business development and marketing executive at Synergy International Systems. For the last 26 years, our company has had the privilege of providing management systems for over 81 countries around the world. Our work spans across a wide variety of domains, and one of these critical domains is social protection. We have had the chance to provide social protection management systems of different scopes and complexity in Timor-Leste, Maldives, Bahamas, Philippines, Indonesia, Trinidad and Tobago, Nigeria, Zimbabwe, and very soon in St. Vincent and the Grenadines and Haiti. Today, we have Dorian Best, Project Officer MIS, who will share the challenges encountered during the pilot implementation of Pulse MIS. And also, he will provide invaluable insights gained from this experience. Additionally, we have Bridget Lewis, Chief Change Facilitator, who will underscore the critical role of change management or change facilitation when implementing and piloting digital social protection MIS. Furthermore, we have Haik Vartanyan, Synergy Project Manager, who will shed light on the technological aspects of implementing a social protection MIS and spotlight the main problems solved with the introduction of the digital social protection system. Dear audience members, please share your questions in the group chat in the Q&A section, and at the end of the session, our guests will give their responses to those questions. At the same time, your microphones will be on mute during the webinar, and you will also receive the recording of the webinar within the upcoming 2 weeks. I see that we have many guests from different countries, different ministries, development organizations, and agencies, and honestly, we're very glad that you are here. My first question will be to Synergy Project Manager Haik. Haik, can you provide a brief introduction to the Pulse MIS project in Barbados, highlighting its objectives, scope, and any specific features that distinguish it from other social protection digitalization initiatives? Haik?
Thanks for the question, Sergey. Sure. So I think I should jump back to 2019, when the Ministry of People Empowerment and Elder Affairs started the process of streamlining and optimizing over 200 social protection programs that were suggested by the ministry at that point of time. The main challenge was clear. So there were different departments within the ministry. Let me just list down the names of those departments so that you have a better understanding on how much Pulse MIS covers, right? So under the MPEA, we have the National Assistance Board, the National Disability Unit, the Social Welfare Department, the HIV/AIDS, the Bureau of Gender, the IBP program, BECS, and the Child Care Board. So the situation was that some of the departments in the ministry were fully paper-based, and some of them had their own local systems developed. However, there was no interconnection between those departments, and the work was not synchronized at all. There were a lot of disadvantages because of this fact, because, for example, the data entry or capturing of the information for the beneficiaries could have happened twice or more because of the fact that there was no unified system in place. And this is when we have decided to create Pulse MIS. So Pulse MIS stands for Poverty Reduction, Utilizing Labor, Social Empowerment Management Information System. It's a unified web platform that brings together all departments of the ministry and unifies the work and connects them together. There were a lot of advantages that Pulse MIS brings, but let me just quickly highlight some of them which are notable. Right? So the first thing I want to highlight is the fact that due to the unification of the departments, now it is possible to refer a client from one department to another just by capturing the basic information through the receptionist form available in the system and then forwarding this information to the respective department. Another notable feature is the integration of our system with the Electoral Boundaries Commission of Barbados. So this allows to verify and to replace the information captured during the initial phase of the data entry and verified with the single source of truth, which is the Boundaries Commission database, right? Another notable feature would be the public portal. This was a separate project, so we have also developed a public portal. It is available for all the citizens of Barbados, and all the assistance programs which are actually provided by the ministry. They're available in the public portal. Especially after the post-COVID phase, it was crucial to have a system in place which will basically give a chance to anyone not to visit physically the ministry, but however to apply for an assistance from anywhere in the country. Then they'll be able to track the status of their applications and get notified once the payment is there. I'll stop here and not go into very much details. So I know that there will be much more related to the system today. So I'll stop here. Back to you, Sergey.
Thank you, Hype. Thank you for giving this overall background information. Now I have a question to Dorian. So basically, we had an overall understanding of the project's background. Dorian, how is Pulse MIS helping you to strengthen the institutional capacity of the government, let's say to effectively implement its social assistance programs? Dorian?
Hi, thank you, Sergey, and hello to everyone on the call. Now, the Pulse MIS definitely will strengthen how the Ministry of People Empowerment and Elder Affairs, and by extension, the government of Barbados will deliver social services to those that are in need. Prior to the system, the different departments, as Ike had mentioned, would keep their own records on each client. Some departments were paper-based and others were electronic, but the sharing of information was always difficult. So the Pulse MIS will change all that. Being a centralized database for all the clients, it will also streamline both the delivery of services, the updating of client notes, and the collaboration among the different agencies that are providing these services. Also, having this system, this ministry would better be able to assess clients, determine their needs and the different means of interventions, and also be able to provide services in a more timely manner. Sorry. Additionally, yes, staff are not burdened by the different amounts of paperwork that they had to enter, because all these forms will now be integrated into the system, and it makes the work of the staff easier in so doing. Further to this, the ministry is also looking to amalgamate the four main social safety net agencies, being the National Assistance Board, the National Disabilities Unit, the Child Care Board, and the Welfare Department. And in so doing, they're looking to decentralize those departments and spread them out into the communities, making the services more accessible to citizens, where they can either come to the community centers and access the services, or the social workers go into the field and meet them in their homes. So having the Pulse MIS is going to be one of those key pillars into making this amalgamation a reality for the ministry. So back over to you, Sergey.
Fantastic, Dorian. Thank you so much. So I believe this is the best moment for all of us to see the current version of the system that was piloted. This would be an exclusive opportunity for other people and employees working on similar digitalization initiative.
So we have here the login screen for the Pulse MIS, and as was mentioned, it's a web-based system, but because we are, for the purposes of this demonstration, we'll be using the test environment that we have instead of the live environment. So as usual, you're presented with a username and password login. So we will just quickly log into the system. And once we log into the system, we're greeted with this landing page. Depending on what your permissions are within the system, you will see a different landing page. But for the purposes of this demonstration, I am logged in as an administrator, so we'll see all the different sections, all the different modules within the system. So we have here the ribbon at the top, which gives you the button here that you can create new applications, and it also gives the user profile and the notification bell, because the system is also tied to persons' email addresses. So as things are assigned to persons within the system, they will get a notification here by the notification bell, and they'll also get a notification in their email. So they can just come to the email, click on the particular notification, and it will carry them straight to the system where they can then log in and then address what everything has been assigned to them. So on the left side, we have the different modules, as was mentioned. We have the analytics module, we have the M&E and the module, we have the receptionist module, where we're here now, we have the receptionist dashboard. We have what I would call the core of the system, which is the household management module. This is where we store all the information as it relates to the clients on the system. So the ministry has moved away from just assessing the persons or just assessing the individual to looking at assessing the entire household. So therefore, we look to capture the information on the entire household to better understand what are the client needs and what are the different needs that we need to address within the household on the whole to help bring those persons within the household out of poverty. We have the welfare module, the IC Bridge program module, health assessment, national assistance board, gender affairs. The different modules are for the different ministries or departments, sorry, under the ministry. We also have the case management module where we track grievances and monitor cases. And we also have the documents management module. And from here on out, we also have the different configurations, the security settings, the configurations module, workflow module, the monitoring, policies, audit, business processes. So as I mentioned, I will go to the core of this system, which is the household management module, and show you what that looks like. So as we go into the household management module, we have here the dashboard for the household management module. And the households are tied to a household ID, and then a head of household who will be the person identified as the main focal point for the household. But it does not mean that these services have to go through this particular person. It's just that this is how the system will see the person in the household. On this dashboard, although it has this information here, is editable, so we can change what appears on the dashboard. So if I click on the household ID, it brings up here the information with regards to the household. Now we have several different tabs here. The general information tab is the tab that has the information that is common to everyone in the household. For instance, the address, the state of the house, the GPS coordinates, because we have here the ability to track the GPS coordinates of a particular household. So if someone is out in the field and they're capturing the information for the household, they can click on the GPS location or find this button, find location, and it will bring in the GPS coordinates for the household, making it easier to find in the future. And also to integrate with any geospatial systems that we will bring up in the future. We also have the household information with regards to the building materials and so on. And we also have things that are specific to calculating the eligibility of the household, which we have referenced here by something named the PMT. So as we fill this going forward, it is like this has combined both our eligibility scores and the different data captures into one form to make it easier to fill this going forward. So you don't have to do two different things at once. You can just do two different things. You can do them all at once. So we have the different options here. And again, based on a particular option that has been selected, some more fields will appear on the screen based on those selections. So say, for instance, the utilities here, illegal utilities, as you select the field, you can see that additional field here appears to be able to fill the information. So it helps the user not be overwhelmed too much. With too much data, it just appears as you require it. And again, you don't always have to fill all of these fields. We have things that are mandatory just for you to fill, and then you can save the information and then come back to it later on. So we have this. We also have the members field. Now, this is where we enter the information about the members of the household. For the purposes of this demonstration, I only have one person, but you can add any number of persons within this household field, or this table, sorry. And then if you wanted to, if there are multiple families that are existing within the same household, you can group them by families here by clicking the Add Family button. But for the demonstration here now, we will just go into the personal profile of John Doe, and we will click on the national registration number here. And it brings open the personal profile card for us to be able to capture the information. Now, like I said, all of the different input or paper-based forms that the ministry uses has been amalgamated into this one form. So here we capture all of the different information on the clients, and it can be very extensive. For instance, in the general information form, we can capture the photo of the person, the national registration number, social security number if they're working overseas, first name, last name, all sorts of different names, the address, the age is automatically calculated, telephone number, nationality, religion, birth certificate, marriage certificate, next of kin. All of this we can capture here in the general information form, and it's extremely extensive. Additionally, the financial information, now this particular tab, once you enter the information for the person in terms of their monetary amount, it amalgamates or aggregates for the overall household. So it automatically calculates for you, if there are 3 persons within the household working, what is the income of all 3 of those persons, and gives you the total income for the household, meaning making it easier for you to better assess and understand what is the levels of intervention that will be needed, because you have an overall scope of both the total income and also the total expenses, because we also have a section here where you can enter the expenses, whether it's personal or household. And we also have the property information where you can update information again with the property. Again, these fields, there will be more information that appears once you click on the different fields. Educational information, you can add the educational level by simply clicking on the add button, and it comes up in the table form, so you can see the educational information going on in tabular form. Health information, again, the health information, the medical conditions, you can list them here in the table form, and you can also update the different information with regards to physician and so on here in the medical information form. The employment section as well, you can state whether the person is unemployed, employed, where they would have worked, etc. And finally, the notes and attachments. Any short notes or any other attachments that you want to make with regards to the client, you can fill here. The notes would be like anything like distinguishing marks or things about the person that you will want to know, just brief snippets of information, but we can also add detailed information in the attachment section where you can attach any document related to the client here. And again, each person within the system is assigned a personal profile number, and we can track who created it and who last modified it. This is across the board for everything that is done within the system. You can see the status, you can see last modified, and you can see who had actually created it. So as we can see here that John Doe is employed, income of $2,500, 53 years of age, and he is the head of household. And this is a snapshot. We can also see if we had applications for John Doe, if there was an application created, the application ID would reside here. As I have mentioned, the household income, so because we have income for John Doe, you can see the total income here is $2,500 and additional expenses here, and it gives you the net income here. So you know that the disposable income of John Doe is $1,200, or for the household would be X amount. Application history, again, once there were applications that were in here for any person within the household, that appears in this section. The PMT, like I said, this is our eligibility score. So based on the information that would be filled, we will see what the person's eligibility score is. In this instance, John Doe is listed as low vulnerable. And again, we have the notes and attachments for the household. So let's get into the meat of the matter and just say that we are going to have a application go through for John Doe and see, we will provide him with assistance. So we will start at the basic, where we will say, John Doe presents himself to one of the agencies and he comes to the receptionist. So we'll start at the receptionist form. So we'll create new receptionist form. So the receptionist form here, we can have it as a new applicant or an existing applicant. But for the purposes of this session, we're just going to have new applicant. Existing applicant will be if the person already exists within the system, like you can just find them quickly. But for the purposes of this demonstration, we're just going to use John Doe over again, but we're going to create him as a new applicant. So we're going to enter John Doe. National registration number. Just enter a number here. Want to give him a date of birth. So we're going to say that the type is walk-in, and he is seeking assistance with a utility bill that is in arrears. So we're going to take a utility assistance, and we're going to have the officer call them back, and we're going to say light bill is in arrears of $2,000. Okay, we're going to select address, enter his address. And we're going to enter a contact number for him so that the officer can contact him. So now we have all the information for John Doe. We're going to save it. And as we save it, you'll see a message appear saying successfully saved. And we will notice that the status of the application is now draft, or the receptionist form is now draft. So we don't have any more information to add here, so we just close it, save and close. And now we have actions. So we can submit this particular receptionist form for review. So it's now under supervisor's review. So the supervisor will get a notification saying that this particular receptionist form has been submitted by the receptionist. So what the supervisor will now do is assign this particular receptionist form to a social worker. And assign this to the social worker. The social worker would then get a message saying that this particular receptionist form has been assigned to them, and they would action it. So we will now go to create the actual application for this particular assistance. Now, the way how the system is currently designed and based on our business processes, we have someone that will create the particular application, submit it to the supervisor. The supervisor will then submit this application then to the social worker, who will go out and do the assessment and then make the recommendations back. But this business process can change at any point, but this is how we have set it up for the purposes of our ministry, and we'll just go forward with that. So we have here now the application date, which will be the date in which the application was made. We can say it was sometime last week. The type of assistance, and it is utility assistance. Being that the client is the person who is making the application, we will just put the same as client here for the contact person. However, the system allows that if there's someone who's making an application on behalf of the client, you can enter that information here. But saying that it is the same as the client, we will just put that as here. And we will enter the utility information. So we will say that it is an electricity bill. The amount is $2,000. Yes, it is in arrears. We'll select the utility bill here. And we will select the company. So now this information has been placed into the system. So after we've done this, we now have to select the household. So we're going to add John Doe's household. So we will search for John and pull up his household here. So we can search via the names, or we can search via the household ID or the national registration number. So we have John Doe here, and we select him as the beneficiary and add him as the applicant detail information here. So now that we have all this, we can save the application. And we see that it has been successfully saved, and the status is now in draft. So we also have other tabs here. If there are additional documents that we wanted to add, we can add them here. Payments, if the application would have been paid or there are multiple payments to the application, they will appear in this tab. If we wanted to link this application to a case, we can also do it here and track the movement of the case through the system here via this case management module. And again, once again, we have notes and attachments for any additional notes and or attachments that need to be added. This will be done by the social worker or the officer that has been assigned. And finally, the workflow status here shows what happens to the application as it goes through the system. So we will look at this or review this once we've completed the application. So we go to save and close here. And we move to actions and we're submitting it for assignment. So we'll send this to a supervisor. So we just select a supervisor and submit for assignment. So the supervisor gets a notification and it says that the application is now under supervisor's review. So the supervisor will now assign a social worker to follow up on this application. So we just assign it to a random social worker here. And that social worker, again, gets a notification about this particular application. So the social worker will see, okay, this application has been assigned to me. The status now is at home verification. So I need to verify that this application is the person's information still remains the same. So once they have done that, they will say, yes, it is the same. So they can go into edit and the notes and say, and add that. And that note here appears. So then we move to the assessment. So the social worker will now assess the client, and based on their recommendations, they will go back to the notes and attachments and say here, in need of the assistance. And once they're finished, save and close once again. So we have the two notes here to review with regards to the application. Please note that this is just the note section. If there was a longer write-up that needed to be done, it can be attached here via the attachment section. So the social worker will now submit to the supervisor. And we see the status is now pending approval. The supervisor can then request more information. So if they wanted to, they can send it back to the social worker for them to provide more information. They can archive, meaning that there's nothing more that's supposed to be done to the application, and it moves it to archive state. They can approve it or they can reject it. In this instance, we're going to approve, but with every single last action, you can put comments here with regards to the application. And we've approved it. And now, if we check the workflow logs, we have the notes here that would have been written. And then we have the workflow logs showing all the different steps that were taken, plus any comments that were made with regards to the application. So now we have actually completed the application for this client. And if we had to go back to the household management module and go on to John Doe, we can see the application appear now in the household for John Doe. So now that we've completed the application and we know that the application has been approved, we're now going to go to the payment section. So we're going to go to social welfare payment, select national assistance, utility assistance, vendor, and we're going to do for this month. Right, so we have two payments here. So we click on this particular one. And we have two different persons in here awaiting payments for their utilities. So for the payment section, we have several different approval levels. So the accountant or the assistant accountant will send to the first approver. And this will be submitted. The first approver will then approve. And then the second approver will then also approve. And once it all has been approved, it will then be uploaded for the payment. And once that is done, we see the table change to paid, and things that may have been in reconciliation, things that may not have been paid, we can move them from being paid to not paid based on what might have happened with the particular application. And once this is all completed, we will archive the particular application. And once that is done, we can download the application or this history, this payment history via PDF. So that in a nutshell is how it will go through from start to finish with regards to how benefits are processed within the Pulse MAS. And also the system has the ability to provide reports based on the different needs that we have. We can have them in tabular format, graphical format, pie charts. The system is flexible enough that you can configure any form of graphs or reports that you want to generate. And this is just a small sample of what the system is capable of doing. But based on your needs, you can also have the system configure reports that can be, or documents that can be exported in PDF that need to be printed and signed by clients. We are able to work with Synergy to be able to make sure that the needs that we have with regards to the system are met. So again, in terms of the cases, you can see the cases that would have been grievances, referrals, case priority. You can have all sorts of different charts here that will give you the information that you need in a snapshot with regards to the system. So that, in a nutshell, is the system. I hope that this was very informative for you. And yeah, there isn't all that we can show because of the time, but it is a very comprehensive system as it needs to cover multiple different disciplines within the ministry.
My next question would be addressed to Bridget. So Bridget, in the context of social protection, let's say, what is the notion of change management or change facilitation in this context from your point of view? And what were the challenges faced during the piloting of the social protection MIS? Bridget?
Thank you, Sergey. Welcome everyone to the webinar. So before I dive into the question, I just wanted to give everybody an overview for those persons who may not yet be familiar with the terminology of change management, or as I call it, change facilitation. In a digital transformation project like the Pulse MIS, we would have two aspects to the project. There's the technical side, as Dorian would have gone into the details of that, which is the implementation of new systems, processes, and tools. And there then is the change management side, or as I refer to it, change facilitation, which is the people side of the change. And what is that really? It's an organizational framework that guides how we prepare, equip, support individuals to successfully adopt these new systems, new skills, new ways of working, so that we can drive project success and outcomes. So we basically move them from their current state through a transition state to the future state. And in very, very simple terms, it's all about helping the people who are at the heart of the change bridge that gap between project solutions, such as the implementation of the new Pulse MIS system here in Barbados, and results. So we want not just for the system to be implemented, but we want to see 100% usage by all persons trained. So that's what the change facilitation part of this initiative was all about. You also asked me about some challenges, Sergey. So one thing that I have a couple of them, but we'll start with the first, which is make sure that when you're doing a change such as this, you identify all of the current state processes, right? Where the implementation of the system will be able to add value so that you can take all of that in the design and development phase and that nothing is left out. What happens, I think, many times when implementing a change is that we go to the managers, right? And we ask them to give us input in what happens in their department and think that managers equate to subject matter experts, but that's not necessarily the case. Managers don't deliver the products and services, but their people do. So what we have to do is connect with the grassroots. So we go to the place of work, ask and observe, and map those current state processes so that we don't miss anything. Because what we found is that having designed the system, there are things that we are now seeing in the ways people continue to do business that we could actually utilize Pulse in order to effect a much more efficient outcome than what is currently in place. So we're seeing where many people are still using some paper forms at some part of the end-to-end process, and that could be we would be able to eliminate the paper if we then add in additional modules for those persons to be able to utilize Pulse to do what they need to get done. The other thing that I would talk about is training, and not just training on the system, because that's very, very important, but also training, because if you're moving a large population of people from a paper-based way of doing things, it's likely that they're going to have some gaps as it relates to their ability to navigate in a new digital platform very comfortably, because mainly they would not have been utilizing systems in the execution of the way they do things. They would be using paper, and the majority of persons would be very comfortable using their phones and all of the various applications that are available through the phone, but this is now an entire way of doing work. And so I would say that we determine where those gaps exist and train people in the use of ICT in the execution of what they have to do at work. Obviously, training on the actual Pulse MIS was crucial. And I think one lesson that we learned from this is that we train when the system is definitely ready to go, because we experienced some shortfalls in system capability, and that caused there to be quite a large gap between when we actually executed the training and when people were actually able to utilize the system. And that then meant that we had to go back and retrain so that, because there's a lot of knowledge loss in the gap, because people were not able to actually jump in and utilize the system immediately. So I would say train when we have all systems go through the whole, UAT process. The other thing is tools and equipment. If we're asking people to now utilize a system that's all digital, then we have to give them the tools and the equipment that they need, ensure that the tools and the equipment are fit for purpose. So things like having, laptops and tablets and reliable internet. Those are some of the things that we have found to be challenges for us that we're now trying to fix, to ensure that once people start to use the system, they don't have issues of not having the right tools, not having reliable internet, and that would cause people to revert to the old way of doing things, revert to utilizing paper, because if we don't make the process easy, the user experience is going to be unpleasant, and people then will revert to the old way of doing things. So I think those are the things that would be critical for us if we were to ever do this again.
Perfect, Bridget. Thank you so much. There are so many questions. So there is one regarding change facilitation, which is the following, and it's addressed, of course, to you, Bridget. How much training or capacity building had to be done to get everyone in the organization at the desired level of performance? And also, Did the introduction of the Pulse MIS result in any job losses, or does it require that even more officials be hired to ensure efficiencies in the system? Taking the number of questions, Bridget, let's be very, very specific for this one. Thank you.
Yeah, so we had to do training. Dorian should smile at this one. We had to do training, we had to do retraining, and we had to do many refresher clinics because as I mentioned before, in terms of the challenges, I'm not sure at what point the question came in, but we did have challenges in terms of people's just basic, the basic knowledge and comfort being in a digital environment. And we also had these lags that I spoke to before as it relates to when we trained and when the system was actually 100% ready to go. So I would say that if we were able to get those things, if we were able to do those things differently, then maybe the training would have been less and we wouldn't have had all of those refresher clinics that we didn't actually engage in.
Thank you so much, Bridget. Again, so many questions here. And the next one, I think it would be addressed to Haik. But dear colleagues, let me know if you want to add as well. It is regarding our technology, the technology that Synergy provides. And the question is the following. Is the MIS compatible with integration to other digital systems? And also, does it have a capacity to automatically generate payments? Haik, I think you can add on this question.
Thanks for the question. So, as I mentioned during my speech, in case of Pulse MIS, we have an integration with the Electoral Boundaries Commission. So basically, the answer is yes. The social protection systems developed at Synergy, they are fully integratable with other platforms through the REST API, and we're able to send and receive information from other systems. As for the second question related to the payroll, mostly the requirement for the Paysheets is to have a business process, business as Dorian showcased, right? In case of Barbados, we have the accounting team, and once the Paysheet is generated, the accounting team processes the payments and forwards them to the Treasury Department, and later on the process is to pay or to reject the payment of the beneficiaries, right? And then reconcile this information and synchronize with Pulse MIS.
Thank you so much, Haik. The next question is the following. What is the technique used in this MIS to avoid duplication in registration phase for members and families, and also at application form received? I think Haik, you or Dorian, you can give your reply for this one.
Yeah, that's a good question, actually. So one of the main advantages of the unification and bringing every department into one single platform is avoiding the duplicates, right? So what happens is that we're checking the national registration number of each beneficiary, of each applicant registered in Pulse MIS. So once there is an NRN and the caseworker or data entry officer is trying to register another member using the same NRN, the system is simply notifying the caseworker that the same NRN already exists and is registered in the system, right? So what happens is that the caseworker goes and searches the person and opens the household and the personal profile and processes the application based on the existing information.
And just to add a bit more clarity to what Ike said, the NRN or the national registration number that he mentioned is a unique identifier for every Barbadian citizen. And that is what we pull from the Electoral and Boundaries Commission, as he said, the integration with that. So it means then that we cannot have the same person in the system with the same NRN, because it means that you're duplicating the person. So that's how we avoid duplication, by having the integration with the Electoral and Boundaries Commission, so that we can authenticate the numbers, the NRN numbers for each client within the system.
Perfect. Dorian, there is another question that I think it would be interesting for us to hear your opinion on this one. Does the system allow other complementary program linkages? And does the system monitor kind or in-kind social protection programs for humanitarian actors for the purpose of reporting during shocks or emergencies?
Yes, and we're actually building out the system to be more resilient when it comes to responding to shocks as well. So the system does have a disaster recovery or a disaster assistance section where applications that have been made or processed during the disaster are also tracked there. And we actually built out a new M&E module that also helps us be able to track when we provide assistance during a natural disaster or any other form of shocks. As it comes to the integration, as was mentioned, the system uses APIs that we can just link with other agencies of other databases and stuff like that. So yes, the system has been built out to take those things in mind.
We have another question regarding the integration, which is the following. Is this MIS interoperable with other administrative registries from the central government, let's say, allowing for checking or self-declared information? Any of the following items?
Currently, we are building it out modularly, but as Ike had mentioned, it uses the REST API. So once we have the different information that needs to be shared, the idea is that let me put it to you differently. The government of Barbados has mandated that all new systems built have to be able to speak with each other. So the Pulse MIS is no different. It has to be able to speak with other systems within our government. So it has the capability to do so. So that's the short answer to that question.
All right. There is another question in the chat. So are we able to translate the system into any other languages? I know that the team is working on implementing the solution in many countries. Hike, maybe you can give us a very short information in terms of how we can translate the system to other languages, for example, to French.
Sure. Yeah, that's a good question again. So, and as you have mentioned correctly, Sergey, one of our recent projects, and it's in progress, basically, we're currently working on developing a management information system for the government of Haiti. And the system is fully in French, right? So the language is not a barrier for us. And here, let me just answer more maybe comprehensively. Also, I'll speak about how flexible our Auxilium technology and our Auxilium platform is. And in our understanding, in Synergy's understanding, social protection systems, the modern protection systems, should be flexible and sustainable. So the requirements gathered during the needs assessment phase, they are not fixed and constant. And what we do understand that the business processes can be changed, the forms can be changed, and the questionnaires can be changed, right? So our system and our platform is flexible enough to accommodate and to get it adjusted to those changes. If there is a need to add a new section to the form, our form builder allows the administrators of the system, who are, by the way, not technical people, they don't know any coding, but our low-code platform allows adding new sections to the forms. Our platform also allows to adjust business processes of different departments within just minutes using the workflow designer of our system. Same comes to the dataset builder and other inbuilt features that Auxilium platform is equipped. One more thing I want to mention is that Synergy Auxilium is modular, meaning that if you already have a household registry in place and the government requires also a grievance management system or a case management system, there is no need to present a completely new and separate system, right? We can just simply create a new entity, a new module within the existing system and make them work together and link those two modules together. And lastly, Synergy's social protection systems are highly available. We do understand that very crucial processes are going on through the systems, like the generation of the Paysheets, and we cannot have downtimes here, that is the reason we're always keeping the system highly available.
How do you envision the procedure of updating the system or keeping it updated with the latest possibilities?
Yeah, so that's basically the flexibility and sustainability, right? So we're trying to adjust to the current needs. So what happens is that we always have system administrators in place who are not technical people like Dorian. So, and we're organizing trainings on ground or remotely, and we're making sure that those people have all necessary skills and capabilities to maintain the system without synergy, right? We do understand that for a lot of governments, there is no development team in place who can later on catch up and continue supporting the system, right? This is the reason our local platform is giving a chance to the administrators to adjust the system by just simply using the inbuilt builders of our platform.
Thank you so much, Ike. We will have additional 2 questions for the moment. So this question, I think, would be addressed to Dorian. How is data dealt with and uploaded when a family member moves and forms a family in another house, let's say? This can be a very specific scenario, actually.
Is a very real scenario, actually. It happens a lot here. We're actually in the process of refining such a particular situation, because we're still in piloting, we're still figuring out some of the things with regards to the system, but we also have very transient clients. So the idea is that we're trying to unify how, because there's so many different other modules that are different departments that use the system, and there are different types of applications. For instance, let's say there's an application for school assistance, where is a case where the child would need back to school items that are provided by the social welfare. It's easy if the household moves from, if the mother and the daughter moves from one household to another, the child is still going to need the educational assistance. However, if the person is moving, let's say, for instance, is a utility that you're about to pay, and they're moving from the location to another location, obviously you need to cancel that utility, but there are a number of different services that we offer. There are over 200 different services. So we're still working through what happens with an application, the status of an application that has already been approved. When you realize that the person has moved, what do you do with that application? So that is something that we're actually working through, because it's a reality. Persons move, and these clients are often very transient, but we're still working through certain peculiarities when it comes to the Barbadian context. And we're looking to implement that shortly. I think we should have it completed soon, where we would have that feature where you move it from one household to the next, what happens. But the general idea is that some applications will revert to its draft state to be reinvestigated, and other applications will continue on to be processed. But we just are working out which applications.
Perfect, Dorian. Thank you so much. Heike, you were working on similar systems and managing the implementation of similar systems in other countries as well. The question is the following: is it possible to make online and offline applications through the system that Synergy provides?
That's a really good question. And let me mention here that what we see here is a web-based application for the ministry, right? However, we do understand that for the data entry officers and for the field visits where there is a lack of internet connection, we do require an application, a mobile or a tablet application that works offline, right? So we have developed similar offline applications in other projects. And the idea behind it is that the social worker or the data entry officer who will be visiting the specific area or a field where there is a lack of connection, first they use the mobile application to synchronize the set of households they are going to be working with. And then they synchronize the information of these households into their tablets using the Synergy offline module. Then they leave their office, visit the field, they're offline, right? So they work with the information which is there in their local devices. They do the necessary changes. They return back to the office and they synchronize this information back with the main system right there. And this is a good example of how effective and useful the Synergy offline module is.
Thank you, Heike. Dear audience member, the other questions would also receive a written reply. And my last question would be to Bridget. Bridget, would you share with all of us one general advice on change facilitation when we are either starting similar initiative or we are in the process or in the middle of a similar initiative, to end our webinar session with a great positive note?
Okay, some of the key get rights, as we call them. I may have a few, but I can go through them very quickly. Just make sure leadership gets it, right? Because you're going to need leadership to drive the project. Luckily for us in Barbados, this was a long-awaited solution. So leadership was really on board very early. But if you have that disconnect, it can really make a change difficult. As I said before, connect with the grassroots, get everyone involved in the process and co-creation of the solution, right? So that when we build a system, people can identify with it. They see where their input is being reflected in the solution, and that makes it so much easier for them to jump on board and utilize the system. Create energy, keep it fresh, always get involved and have people, involved at every single aspect of the change in the UAT testing and all of that, even before the solution is delivered, and analyze and personalize. Incentives matter. Okay, so one thing that we're doing is we're piloting this system before it goes live to ensure that we identify any issues before we go live, because if we go live, there are consequences, negative repercussions, not only to the staff, but also to the client, and that's what we don't want. So make sure that we have pilots in place and that we're incentivizing people to participate in the pilot and to utilize the system, because if we don't have them using the system, then we're not able to test it fully and uncover any potential glitches. Understand what the benefits are. So what? Why do I have to use this? What's in it for me? Make sure that the benefits are very clearly defined, and make sure that the organization is future fit. Okay, so refine the processes to remove barriers, upskill the business to enable sustaining the change post the go live. Very, very important.
Thank you very much, Bridget. Dear audience member, as I said, the rest of the questions will receive a written reply after the live session in the upcoming days. And also, please note that the recording of this webinar will be shared with you via email in the coming weeks. And also, we will post it on our YouTube channel for your convenience. Dear guests, as a conclusion, we would like to extend our heartfelt thanks to all our speakers and participants for their important contributions and insights today. Please reach out to us if you want to learn more about our technology or successful system implementations in the domain of social protection and beyond. As we move forward, let's continue to collaborate and innovate in our collective efforts to enhance social protection systems, and at the end of the day, make a meaningful impact in the lives of those we serve. Thank you for joining us, and we'll look forward to further collaboration in the future. Thank you.